building a better Bay Area for a safe and secure future. This is ABC 7 News.
Hi there, I'm Kristen Z. Welcome to our daily program called Getting Answers. We're asking experts your question every day at 3 to get answers for you in real time. Today, we're covering COVID-19. We're going to begin with Dr. Alok Patel. And the reason we brought him on is because 2 different counties announced today, Alok, they're going in 2 different directions. San Francisco announcing it will postpone opening indoor dining and outdoor bars indefinitely. They were going to open next week, but no longer. An announcement for hair and nail salons expected later this week. And now, Alok, you know, in Santa Clara County, they've just been given approval by the state to move forward with their variance plan. So that paves the way for outdoor dining, not indoor, outdoor dining, salons and gyms to reopen with a target date of mid-July. So if you are confused, then you're just like everybody else, because our heads are spinning from all these counties that some saying this activity is okay and that's not, whereas other counties have a different risk assessment. So I know, Dr. Patel, you've been busy working on a risk calculator for us that you're going to share with us today, right?
Oh, totally. Because honestly, if people look at the different counties and which businesses are selected and which aren't, it's totally confusing. But it just comes down to certain variables about safety that we're all in control of.
Okay, so we're asking you, the viewers, to play along with this game show quiz. Actually, it's very important, though. It's on our website, abc7news.com, which you can check out. But here it is, 12 common scenarios, and what's your risk? So let's begin. Alok, don't feel, bad about putting me down. Say you're just way off here, Kristen. That's okay. I can take it. Let's start with the first one, play dates. I am going to guess that the risk for that is medium.
So for this specific one, you're not far off. We said it was low for this specific scenario, but the reason why is because some people have told me that they have play dates where they're with a group of people they trust, they're in a social bubble, and everyone is really responsible. That risk could change depending on who you're play dating with and the location of that play date. So you have to take a lot of these variables into account. So
that
low
makes
to medium,
sense.
let's say that.
Okay. Haircuts. Let's go ahead and take a look at that one. Again, this is a specific scenario, but I'm going to say, medium again, because you're in close proximity to someone.
Yeah, so we said medium as well. And we said medium because even though you're indoors and there's close proximity, according to everyone we've talked to who's in the industry, they're going to be wearing masks. They're going to limit the amount of people inside. So there's still an exposure, not a whole lot. So we're going to put it right in the middle and say medium.
Okay. All right. Yoga. Now, that is the next one on our website in the quiz. And then also we have another one. Wait, what did you say? Producer talking to me. Hang on. What?
You might be a yoga fan.
I'm good. Wait, is this goat yoga or hot yoga? Any kind of yoga? Here we go. Okay, this scenario, sweating it out, sweating the stress out. If this is indoors, I don't know if you guys put this indoor or outdoor, but I'm going to say high because you're breathing heavily, I would think. I was right.
We made this one. So you're right. This specific scenario, we called it high because this was describing yoga inside a studio. You have a lot of people there. People are sweating. There's shared surfaces. There's a chance people aren't wearing masks. The ventilation may be compromised. So I apologize if I'm pissing off a lot of yogis out there. For now, try doing yoga outside or in your home virtually. Because going to a studio, high risk.
Okay, outside with goats, preferably. Okay, how about...
Sure, I love goats.
Okay, me too. All right, let's take a look at the next scenario. Folks at home, continue to play along with us, and then later you can go on our website, abc7news.com, to find it. Vacation, California, Southern California beach. Ooh, okay, I'm going to have to say high.
You're spot on. So this one, vacation, there's a lot of variables here. You have to get on a plane. There's a risk of coming in contact with other people. Think about also the county you're coming from and the county you're traveling to. So Southern California has a rise in cases. We call this one high, but vacation could be a family drive to a place that's a little bit more physically distanced, less cases. And in that scenario, it wouldn't be high.
Okay, shopping is our next scenario. And again, I think this makes a difference whether you're indoors or outdoors in a packed mall or not. But I'm going to guess you're going to call me like, straddling the fences or, but I'm going to say medium again. Oh,
so we
low.
call this one low.
Okay.
We called it low because remember, there's different degrees of shopping. If you're doing curbside shopping, and you're being really responsible about it, you're low risk. I wouldn't recommend people crowd into a store right now because then you're going to raise that risk higher. But for this scenario, we called it low. I'm assuming all business owners and patrons are responsible.
Got it. I do go to the farmer's market, and I feel pretty good about that risk being low. Everybody's masked. We're outside. So, okay. How about visiting the elderly? Now, grandparents, my kids will go. We'll visit my parents. You drive to visit them in a city where there've been COVID-19. Okay, I'm going to say, oh, wait, you don't wear masks. Oh, I'm going to say medium. Oh, hi.
These people aren't wearing masks. They're also visiting a high-risk population. Now, I know I'm sorry, Grandma and Grandpa, but you have to be really strict right now about who's visiting you, about wearing masks, and about what county people are coming from. All these are big factors people need to take into account when they're visiting any high-risk population. So this one we called high.
Okay. Next one, party. I think I can guess this one, although I don't know about the scenario you laid out. I'm going to say extreme.
Extreme.
Oh.
Everyone,
Ding,
listen,
ding,
everyone
ding.
loves an extreme party.
Yeah.
But like people in this scenario were not wearing masks. They were sharing drinks and food. And also we know that when people drink, they're more likely to not follow the rules. We all remember college. So that's why for this scenario, extreme. Avoid those indoor parties right now.
Got it. Okay, I'm just happy I got another one right. Okay, summer camp is next up. And of course, many of us who are parents have been weighing that, right? It'd be nice to send the kids out to a camp, but at the same time, the exposure, the mixing, and the facilities, I'm going to guess, you know what? I'm going to say medium because I see the counselors are reminding the kids to wash their hands. Ooh, I was right.
You're right. So medium is kind of spot on there because there are some areas where there's high risk, some where there's not. I would encourage every parent who wants to send their kids to camp to talk to the camp itself and find out what type of safety measures they're going to be enforcing and how they're going to protect your campers.
Okay. Next one is dinner party. I know a lot of people after, not socializing for some time, they're starting to have dinner parties with small groups. So the scenario you laid out, sit down, oh, we share big platters. Ooh, no one's wearing masks. Okay, I'm going to say extreme.
Oh, you're going all out on this one.
And it was medium. Why?
So we call this one medium because this specific group, we're taking the steps to be a little bit more responsible. You can absolutely make this extreme. If you're sitting really close together, you're sharing plates, and you guys are not necessarily following the right rules. But you can also mitigate the risk. If you guys bring your own silverware, your own dishes, you try to sit outdoors, you're with people whom you know are not getting other exposures. There's ways to mitigate the dinner party risk.
Gotcha. Okay, camping is the next one we have laid out for you. I always hear being outdoors is great, and it seems like people are spaced out, so I'm going to say low. Yes. Ding, 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 ding. I was right, Dr. Patel.
You were right. So camping, you're right. Camping, you have a higher chance of being physically distanced away from people. You're hopefully with your own family or your social bubble. And you also are outdoors, which the air exchange is a lot better. You're less likely to catch it here from person-to-person transmission. Camping, great vacation option.
All right, two more to run through real quick. Next one is riding the bus. Could be a busy bus, I don't know, so I'm gonna say high. Oh. Low.
This one we called low, and we called it low because if you follow all the right guidelines, which they did in this scenario, you're wearing a mask, you're wiping down surfaces, you're trying to avoid touching anything, and you also may not be in the bus for a long period of time around other people. Because remember, your time next to people and that person-to-person exposure plays a part as well. So you can make this a low-risk activity if you want to call bus riding an activity.
All right, the last one we got in your quiz is going to the gym, wearing a mask. Very apropos because next week Santa Clara County could start that, opening the gym. So I am going to say, I'm torn between low and medium, but it sounds like the person is taking precautions, so I'll go with low. Medium.
We call it medium. There are some gyms out there who are trying to do the responsible thing, but there's others, it's really hard to actually account for all those shared surfaces. Think about the dumbbells, the equipment, the benches, everything needs to be wiped down. People may not be wearing masks. There could be a lot of people in there. Simply because of the variation in gyms, we had to give this one medium. There's probably a combination of extreme and low.
Okay, Dr. Patel, I'm a little sore because I think that was a B- at best on my part. But hey, I learned something, and that's what's important. Not the grade, but the actual learning, right?
But you know the risk factors. You know the risk factors, Kristen. I have faith in you.
Okay, thank you. I appreciate that. We'll continue to ask your questions of Dr. Patel over on our live streams right now. Take a short break on the air and be right back with more. All right, Dr. Patel, that was fun. Okay, let's continue. Our viewers want to know, Megan says, what about beaches? Low, medium, or high risk? Let's go with that.
I would probably put beaches, Megan, on like the low to medium spectrum. You know, it's absolutely not zero risk because we've seen some really crowded beaches. But also remember, you can go to a beach that doesn't have that same type of population density. You can not be in a cabana with like 25 other people like we saw over the 4th of July weekend. So just remember, you're outdoors. That's one great thing. You're away from other people and you're reducing the amount of shared surfaces you have, you know, kind of you're in contact with, and you can make this a low risk activity.
Okay, and as you heard today, San Francisco Mayor London Breed said they're going to make a decision in the coming days about opening outdoor zoos. So what about that one? Someone is also asking, outdoor zoos risk, low, medium, high?
I'd probably put outdoor zoo kind of in that medium risk. You're going to have a lot more people there. People may be spending more time in confined spaces at the zoo. You know, I'm not sure if some parts are indoor, outdoor. You have elevators, exhibits, all that stuff. But remember, regardless of what risk we put on these things, it's up to human behavior. So even if we said beaches are low risk, we saw that people go and crowd the beaches. They could do the same thing at zoos as well. And so, you know, even if zoos are open, it's up to us to do the responsible thing or to ruin it and have them taken again.
Right. All right. Ann Fox wants to know, what about laundromats? Low, medium, high risk?
That's a really good question. And I would probably put laundromats at a medium risk. I would absolutely encourage anybody, if you have a laundromat you're going to, or if you're using a laundry room in your building, to ask the building or the owners what they're doing to sanitize that space. And also make sure you're absolutely wearing a mask, because you're usually going to be in a smaller indoor space with poor ventilation. And there's a lot of shared surfaces. There's knobs, there's change machines. So bring hand sanitizer or wear gloves. If you do all those things, I think you can really, really reduce your risk at a laundromat.
All right, sounds good. Dr. Patel, we're coming back on air in about 10 seconds. So you can hear the voice of God, right? Otherwise known as the director.
I can hear it. Director is God.
All right. All right, and we are back with Dr. Alok Patel answering your questions about the risk level of various activities. Let's cover a few more before we get to other questions. David York wants to know, how dangerous is it when a non-masked person walks or jogs by you on a sidewalk?
Well, remember, if you're outdoors and somebody jogs by you, in order for them to really infect you, they would have to cough, sneeze, or even scream out, and respiratory droplets would have to fly in your way. It's possible. It's a little less likely if it's a simple jog by, but think about an unmasked person standing next to you in a confined space, and the risk all of a sudden gets a lot higher. But still, if you're outside, try to avoid people, even if you're jogging.
Okay. How about, can you kind of better explain the dangers of dining inside versus outside?
Absolutely. So when you're dining inside, the number one thing that is going to be the huge difference here is you're inside. And so ventilation becomes an issue. You know, there's a big statement right now about coronavirus having airborne transmission. And we know these droplets can spread around inside and bounce around from the walls depending on the air conditioning and ventilation from windows. When you're eating, you're also not wearing a mask. And depending on the restaurant space, they may not be able to adequately move tables, 4 to 6 feet apart from each other. So these are all things to take into account. I've seen some restaurants with really small spaces inside and poor ventilation, but a lot more space in their patio. And so that's where it all comes down to play. And then, there's also a risk of shared services as well.
Yeah, okay. Ayo Kaz has a question about how dangerous is it to be at an office where there are more than 50 people?
I have to ask how big the office is and also how responsible everybody else is in that office. There's certain variables that you can really take into account. Your time spent indoors around other people, how other people are behaving, physical distancing, the indoors, these topics that we keep bringing up. So your office, you have to look at space. You have to look at how far you are from everyone else, but really, really hold each other accountable. If you see somebody not wearing a mask or someone not washing their hands or somebody touching things, it's okay to tell that person, like, you're increasing your risk of catching COVID-19 and spreading it to everyone else. I think we really have to be open with one another about mitigating risk right now.
Very much so. Okay, I want to shift gears now to take a look at more data and evidence and what we're learning about COVID-19. As you know, California Assemblywoman tested positive for COVID, forcing them to shut down the Capitol building for cleaning. She says she tested positive and it was a mass-to-mass infection. I think what she means is that both parties wore a mask or something like that, and there was a transmission or infection. And a lot of people do wonder, are masks really effective? So can we take a look at this case and talk about the effectiveness of masks?
Well, the first thing we can say off the bat is there is crystal clear evidence that masks are effective and masks work. You know, there was a fluid dynamics study, I believe last week, showing that if somebody's wearing different types of masks, from your cloth mask to double stitch home masks to N95s, droplets coming out actually are a lot, they travel a lot less far than if you're not wearing a mask at all. We know they work. Now, if somebody were wearing a mask and they still caught coronavirus, you have to think about all the times they weren't wearing a mask, or the times they accidentally touched something and then touched their eyes. Or, you know, did they take their mask off when they were eating something in a restaurant? There's a lot of other factors to take into account. And I think one thing people should think about with this specific case is if you catch coronavirus and you don't know where your risk exposure is, this is where contact tracing is so important. You know, whether or not somebody calls you or contacts you, you have to really think about all your steps. Every business you went to, every restaurant you ate at, people you came in contact with, friends you saw, and those are all other tricky ways for person-to-person transmission to play a part.
All right, I want to touch on sports. Based on everything you're seeing, are the professional sports, whether it's NBA starting in that bubble in Orlando or baseball, the way that they're doing it, how confident do you feel that they'll be able to be played in a way that limits COVID transmission? And as you heard, the Giants today suspended further workouts until they get their results back.
It makes me nervous, and that's solely because of the amount of players. Now, trust me, I am just as much of a sports fan as everyone else. I direly miss my NBA, even though I'm a Phoenix Suns fan, not a Warriors fan. I'm so sorry, everyone. That came to you live. But, you know, theoretically, if you think about a social bubble with 3 to 5 people you know and trust, you are to expand that. If everyone in this social bubble NBA squad was tested regularly and followed all the rules, I see how that risk could be a lot lower. Now, again, this requires that every single person involved in the sports leagues is following their part, and every single trainer and everyone who's involved in the planning, everyone is actually following this as well. So this is actually going to take a large effort, a lot of contact tracing, a lot of testing, a lot of surveillance, and a lot of players actually following the rules as well. So if everyone does their part, I think it's possible. It doesn't mean it's without risk, though.
Right. And we hope everyone does their part, because from what we've seen, society at large, not just in the sports world, people don't always, you know, do their part. But I imagine with so much at stake, they will have a higher standard. So we'll see. All right, Dr. Alok Patel, always great talking to you. Learn something every time, other than the fact that you have poor choice of basketball teams.
Untrue. Untrue. They're going to make a comeback one day, hopefully soon.
All right. Take care. Talk to you soon. We're going to take a short break on the air, but the conversation continues on our live streams, including abc7news.com. Be right back. All right, folks. Nice of you to join us today. We have 2 doctors, not 1, but 2, because you can never get enough. Okay, we have Dr. Peter Chin Hong coming up next with us. Hey, I'm trying to find Peter's tweet, the one that we want to launch our conversation from. Was that July 3rd? Was that July 1st? I am confused. Which date was that? We're going to answer more of your COVID questions coming up. Meantime, I'm multitasking here. Okay, hey Peter, how's it going? Eric, I found it. Yeah, here we go.
1 minute.
It was July 3rd at 10 a.m. Yeah. Hi, Peter. How's it going?
Hey, I'm good. How are you?
Good. Good to see you again. Although I see
Definitely,
you
thank you.
everywhere. I see you on all the channels, on Twitter, quote in the papers. So you're everywhere. Ubiquitous. How's that?
I know. It's just for the time being. It's going to go away at some point. So
No, but I mean, all the things that you say are super valuable. So I'm glad you're here. Eric, how much time do we have with Dr. Chin Hong? 6 minutes on air and then 2 minutes on Facebook after. Okay. You go with that?
yeah, that sounds great.
Perfect. All right, coming back on air in 10 seconds. Eric, do you want to hit some of these social ones first or no? Social first?
4, 3, 2, 1.
All right, from one doctor to another, because you get two for the price of one today, let's bring in infectious disease specialist from UCSF, Dr. Peter Chin Hong, one of our favorite guests. Dr. Chin Hong, every time, I guess since we last talked, you have become quite famous on Twitter. The latest tweet that went viral was one in which you really dove into what happened in California, fearless in COVID-19. Take us through what happened, how we went from sort of this California miracle success story to being in this situation now where we're seeing the numbers rise in a way that's very alarming.
So thanks for asking that question. It's such a complex and multifaceted issue. But I'll walk through some of the issues that some of us have been thinking about. I think, first of all, I think one of the main issues that we saw in the 1918 Spanish flu pandemic was the idea of shutdown or lockdown fatigue. I think people do get tired of staying and being good all this time. We were amazing, and that's why we were the California miracle. And what happened in 1918 was that everyone was opening up. People were jubilant. They had mass throwing parties. They threw it up in the air. Everybody's happy. And then the second surge was much bigger than the first surge. So I think history repeats itself, hopefully not so bad as 1918. We have better care now, but that's the history part. I think the other part was that, we were doing different things and opening, SoCal was doing something else. In fact, like we talked about before, you kind of had to look up a website to figure out where to do this and where to do that. So I think everyone got confused because some places were more open than others. Like you can go to the gym in LA and you couldn't in many parts of the state. So that was confusing to people. Also confusing was the kind of messaging that we were getting about protecting ourselves. Early on, people were saying not to wear masks, and then people changed. And I think that that's confusing to people, but I do think it's because we got more and more data. But I think the messaging as to why we changed and having a central voice is so important in all of that. So, that is part of it. But at the end of the day, people get tired. They go to the beach, they go to the bars, they hang out on Santana Row, and,
Okay, so your big fear is history repeating itself because you mentioned the 1918 flu. Talk about what happened in the second wave and what the lesson is for us now.
The second wave was that, there was no dimmer switch like what Governor Newsom was encouraging us to do. People just basically turned the light on, and it went from nothing to everything. And then it was like Florida or Texas all over again, except that was in the Bay Area. And I think what happened, it was complicated by other factors. Soldiers were returning from the war, so that they were also bringing infection. So it was a little bit different, but then similar in the ways in which reopening occurred. But that reopening was very, very dramatic and different to us, meaning that I'm an optimist and I still think we have a chance. We can beat it in California. We're not quite a Sunbelt state yet, and we can make an impact.
But you talk about the confusing messaging for the average person because you hear different things, not just, from federal to state, but also county to county. Like in San Mateo County, you can still dine indoors, Contra Costa County, and in Santa Clara County, you cannot. And in San Francisco, they're also not going to reopen for indoor dining. And Monterey just rolled back indoor dining after doing it for 2 weeks or something. I mean, what is the effect of this kind of whiplash in terms of the rules?
I mean, there are two effects. One of it is that you're confused, right? So maybe you think it might be okay in your county to be more relaxed, and then you get frustrated when it's not the case, and then you rebel. So that's one thing. The other thing is you just, I don't want to say game the system, but if you wanted to, dine indoors, you can go up to wine country if you live in San Francisco. So you kind of figure out what to do. We are becoming more mobile, and that's what the mobility data shows. So, you kind of move around, we get more courageous. I think in the beginning, we were more fearful of COVID. We didn't know what was going to happen. And now we're like, we didn't know anybody with COVID. We weren't in New York where anybody average knows somebody who had COVID.
Right. So I guess my question to you is, as a group, as doctors and researchers, do you wish for, hope for more consistent, unified messaging coming down right now from our government?
Yes, so much so. I mean, that will be my dream. I wake up every morning and I think, wow, wouldn't it be great to have a radio announcement that's going off every 5 minutes saying, just like seatbelts, did you wear your mask today? Did you leave your mask? Did you bring your mask with you in the car? Something like that, that's sort of like brought to you by the CDC or brought to you by the Health and Human Services. And I think that's sort of like consistent. And even if it changes, I think the consistency trumps change, because everyone changes at the same time.
Right, right. All right. Hey, a couple quick questions from our viewers for you before we run out of time. What's the risk for teachers, daycare providers that are wearing masks, but the children they see are not?
Oh, that's a great question. Of course, the more people wear the mask, the better. But the youngest children are probably a little bit more protected from either getting or transmitting. That data is sort of like not fully out there yet, but that the idea is that when they've done biopsies of some of the kids, they've actually found and looked for the ACE2 receptors where the COVID kind of fits in like lock and key. There aren't that many in the youngest kids, but there are in older kids and adolescents. So depending on what age range you teach, the risk will be a little bit different potentially. If the kid has COVID, of course, asymptomatically, and you don't, and you're the teacher, you're probably going to have a little less protection. You're still going to have protection than vice versa.
Okay, Dr. Chin Hong, we're going to take this conversation on air where I'm going to ask you about the mutations and how many strains we have right now. Join us on Facebook if you want. All right, so we've heard about, the virus mutating, maybe becoming more virulent. Can you talk about what we know for sure about the different strains?
Yeah, so I would say like the best use of strains right now is to find origin of viruses. So when they do epidemiologic studies, like we did one in the Bay Area with Dr. Charles Chu, he can say, well, in the Bay Area, we had all these different kinds of viral origins. So like a bunch came from Washington, there was some from China, and we had very little New York, which is more Europe. So, and the way they do that is they look for very minor differences in proteins on the surface of the virus, but they're not major enough to make a vaccine to one not work for another. Okay. Now, the new information coming out about different strains and transmissibility, it's more of a lab thing and hasn't really been translated into human data yet, because independent of strain, there's also super spreaders and people who can probably spread more, like the person in New York who spread to like 100 people. So it's independent of strain. So it's hard to study and to be conclusive. I would say the scientific community is mixed about that right now.
Okay. Hey, today I read about, I forget which company, but they got $1.6 billion from the government to work on their vaccine.
Yeah.
And I'm just wondering, what is the talk in the medical community about these vaccines and kind of the hyper pressure, hyper speed that they're trying to go at to announce something?
Totally. So there's Operation Warp Speed from the president that's giving billions of dollars, basically, partnership between lab and pharma in general. I think the race is on, and it's kind of like, there's science and there's politics, and you want to look at two things, safety and efficacy. And I think the public is most worried about safety, and then, we're worried about efficacy as well. So those will be the factors that people look at.
All right, fingers crossed that it'll be warp speed and effective and safe. Dr. Chin Hong, always good to see you. Take care.
Same here. Thanks so much.
And we're back on air. Thanks so much for joining us on this interactive show, Getting Answers. We'll be here every day at 3 on air and on live stream answering your questions, Facebook Live, YouTube Live, abc7news.com, and the ABC7 News app. World News Tonight is next. Bye-bye. All right. Thank you, Facebook friends. Lots of you tuned in today. I appreciate the conversation and great questions. Take care.